Here's the story now of Medicaid in 2019. For the vulnerable in America, our people want to make sure that there is more access to Medicaid. Unfortunately, on the other side of the aisle, Republicans are taking that very access away. So just for a few minutes, I'm going to draw out this contrast, because there is quite a difference of opinion between how the majority party and the Trump White House are working against the interests of vulnerable folks across the country. As I mentioned, 2016 saw the beginning of this all-out attack by Republicans on Medicaid. Hundreds of billions of dollars in cuts, proposed caps, block grants, basically an unraveling of the program as we know it today. So essentially, from Portland, Oregon to Portland, Maine, people said, no way, we're not going to support this kind of attack on Medicaid. So in some states, like Utah, they chose the ballot box to actually expand Medicaid under the Affordable Care Act. The voters chose more access to Medicaid, not less. But Republican lawmakers in Utah have decided to deny them their choice. Just think about that one. I sure hear a lot of talk on the other side of the aisle about states' rights and empowering people at home. This is an example of where voters chose more access to Medicaid, not less. But Republican lawmakers said, hey, we know better than that. We're not going to give folks that choice. So Utah lawmakers took a hatchet to the plan that voters approved on Election Day and started carving it up. The only expansion they'd allow was a lot smaller than what voters wanted, spending more money to cover fewer people. Then lawmakers in Utah followed the path cleared in other Republican-controlled states, and that was to punish those who are enrolled in Medicaid with essentially bureaucratic water torture, with just such a barrage of paperwork, so it was almost impossible to penetrate what was really necessary to get through the program. This has been seen in Arkansas, Kentucky, and elsewhere. Now, all of this, of course, is not couched in the bureaucratic maze of red tape it actually is, but the discussion is always said, well, this is just about work. That's just not true. It's about getting people kicked off their health care. When you talk about Medicaid patients, you're talking about people who are working and people who want to work. And what we're up against are a host of Republican schemes that are basically putting stacks of paperwork between those who need health care and their doctors. Now, these are busy working people with kids to raise, older parents to care for, bills to pay. And yet lawmakers are trying to force them to fill out stacks and stacks of paperwork just to make sure that somebody can actually get their way through the maze and see a doctor. If you look at what happened in Arkansas in 2018, you get a sense of how destructive these bureaucratic schemes are to people's health care. 18,000 people lost their Medicaid coverage. 18,000 people. Trump officials swore up and down that those paperwork requirements wouldn't hurt anybody. But as we saw when the Secretary of Health and Human Services came before the Finance Committee earlier this year, they shrugged when you asked why so many people lost their coverage in Arkansas after the paperwork requirements were put in place. A federal judge even weighed in, blocking all of this paperwork while the Trump administration continued to push the states to take them up. Now, the schemes spread to states across the country, and it is not just paperwork. Now, with the Trump's blessing, the Trump administration's blessing, Tennessee is the first state trying to turn its Medicaid program into a block grant. This basically takes a sledgehammer to Medicaid as we know it now. Medicaid block grants mean putting nursing home care, which I just outlined earlier in discussing Senator Casey's important role here. Block grants put nursing home care at risk for millions of seniors. You risk for children and people with disabilities, having them cut off from their health care. But block granting Medicaid is one of the top goals for Republicans in the Trump administration. Finally, Trump administration budget slashers are trying a new additional scheme that's going to hurt so many people across the country. They basically, in this particular area, are trying to bring some mathematical sleight of hand so they can change key economic measures in ways that boot vulnerable people off Medicaid and off food stamps. What they're doing here, and again, this is all shrouded in language that just sounds eminently reasonable, they're basically talking about where the poverty line ought to be, and then they want to find an artificial way to push the poverty line down without doing anything to lift people out of economic hardship. So you're talking about parents who work long, hard hours and still struggle to make ends meet, people who are trying to find affordable housing. They've practically given up the idea of being able to save for retirement. They're still trying to pay college tuition. And what does the Trump administration say? These people just have life too easy. The impact of this change would be enormous. 300,000 children could lose comprehensive health coverage. 250,000 adults could lose their coverage. So this, colleagues, is the Medicaid agenda for Senate Republicans and the Trump administration. Let us go out there and look under every possible rock to find a scheme to restrict access to Medicaid. That is the agenda. Find a way to cut the funding, to deny expansion after the voters approved it. Now, I'm going to close because we now have two members of the Finance Committee with a long history of advocating for vulnerable people facing health challenges, and just say this. Ever since I was director of the senior citizens, the Gray Panthers, I've always said the single most important issue in America is health care. Whether it is North Dakota or Michigan or Maryland, if you and your loved ones don't have your health, everything else pretty much goes by the board. And somehow that message has not gotten through to the majority here in the Senate, because under this majority and under the Trump administration's health care agenda, they're buying into a completely different set of principles. They are willing to set millions of Americans back with respect to their health care needs.